Hi there. I've just put a bit of chocolate in my mouth talking about dental care, which I've now had to just pull out quite quickly. I didn't realize I was on for, should have read the notes more. Um, so yes, so you're going to get four sides of the story really from me, from various family members. So as Patricia said there, nobody knew that we had a Y until either late 2010 or early 2011. I can't remember exactly when it was named. Um, After I had had my first son, Oliver. So I was 34. As you said. So before this time, obviously going through life as we were, my dad would be the first to, and being the oldest, obviously, in the family at that time, to suffer dental issues. He had all of his teeth removed when he was about 26. I believe just a lack of, I don't know what it was. They crumbled, basically, is really what you can remember from that. Um, so he has obviously had lived with false teeth for most of his life. And then the next thing that happened, my brother, he was probably in his early teens, maybe 13 or 14 at that time. Everybody was being given fixed braces, and he had them for not very long that we can remember, but when they went to take them off, his teeth crumbled and all the enamel was taken off of his teeth. And as a result of that, years later, he had the same. His teeth crumbled, and he's had a lot of his that are plates, and don't really know the extent of that, to be honest. He's not really one for sharing. Um, so here's me being quite smug, living my whole life to probably about early 40s, thinking, oh, I'm the only one that's not had any issues. I've got some teeth missing, um, which the dentist when I was growing up had wanted to pull out from different places and um, sew in, other bits in my jaw that terrified me. So when you were doing a brief introduction there, someone had mentioned dental anxiety. I definitely had that and have grown up with that, and I still have that. Um, and it's become worse the last few years. I don't know if it's to do with hormones. Women get to a certain age, menopause, that kind of thing. It probably affects, well, it affects a lot of things, doesn't it? So why not your teeth? So yeah, so I have say teeth missing. I don't have any eye teeth. Various gaps. I've got a lot of molars missing. Strangely though, I do have I've had four wisdom teeth out, and I have now another two. So I don't know how I've been lucky enough to have that. I need to have sedation to have any dental treatment. One, because I'm terrified. Two, because my jaw dislocates or can get stuck, and just the pain of it. Even having to get my teeth cleaned is an ordeal and has to be done manually. My dentist is very good, and um, to be honest, though, I didn't realize how good until I knew the questions to ask her following a meeting that I'd had up at the Brittle Bone Society with Corinne and um, some of the dental students that had come over, and I knew what questions to ask, for example, to different toothbrushes that are available. So I think it's always been a scenario for me that nothing's really forthcoming, but when you ask the right questions, it can have a good outcome, which is good. But I dare say that's not the case for everybody. So I'm now being referred for a couple of things. So I've got TMJ. I'm sure probably you all know what that is. Temporomandibular joint disorder, and also the issues with teeth missing and teeth crumbling and things as well. So they're kind of different. I think one of them's a dental hospital and the other one's I think it's Forth Valley Hospital. So again, that's an issue because it needs to be done under sedation. Um, so I cannot remember the last time I woke up without having pain in my ears, my throat, swollen glands in my neck. And I believe, and I'm led to believe it's caused by the TMJ and issues with arthritis in my jaw. Um, I have had in the past Botox injections into my jaw, which was done privately because I don't believe I'm told it's not available in the NHS. And that in itself is a horrendous experience. I'm not averse to the odd bit of Botox, but it's usually a needle that size. This needle was not your average Botox needle. I mean, it was like a super soaker thing that the kids play with these water pistol things that he did into one side of my jaw. Um, and after he's done this, he said, I think you would be the ideal candidate to be the first person I've operated on and done a full jaw replacement on somebody with a Y. Needless to say, I wasn't up for that. You can look for another guinea pig for that. Um, so where we are at the moment, yeah, lots of teeth missing, crumbling, bits of, I don't think I've got any fillings as such, but yeah, just bits of teeth that have had to be patched, filed, made to look like eye teeth that I don't have. Yeah, so that's all going on at the moment. With Oliver, who's now 15 and a half, he was recommended for fixed braces. They said that he would have to have them, but because he'd heard of my brother's really, really bad yeah, carry on with the fixed braces. Oliver is terrified now to get fixed braces. And to be honest, I don't think he needs them. He has a lot of teeth missing as well. And they can't really give us a good enough answer um, about what they can do with that. We don't even know if our jaw is strong enough to support whether it be implants or I really don't know what's available. And it just feels like a constant uphill struggle trying to find where to go. And I would say that that's not really much different between the experience I've had as an adult and what Oliver's now experiencing, because we're kind of left in limbo that, they've left it up to us to, will come back to us if you decide that you want the fixed braces. So I'm not really sure if that's good enough. And Oliver certainly, 15 and a half is old enough to make his own decisions. And at the moment, he's not willing to take that risk either. So that's where we are. Yeah, so that is my lived experience. Um, and at 49, I still have dental anxiety. I wouldn't even get a filling without sedation. And yeah, that's where I am. So I hope that helps.